Our group focused on health and mobility, and we actually started the afternoon by sharing a little bit about what each of us have experienced personally, whether it's been in our own lives with our own health. Many of us have aging parents who we are trying to be caretakers for, or oftentimes remotely be caretakers for, and thinking about the areas of the community that are dealing with disabilities. I mean, when you think about it, there are so many places in the community right now where it's difficult for people to get out and be part of the community, much less get good health care as they move forward. That could even be latchkey kids. We talked a little bit about that as well. But as we stepped back and we really thought about some of the bigger ideas, well, actually what happened was we developed, like everyone else, hundreds of ideas. As we stepped back and we started thinking about, well, what are the bigger concepts with all of these ideas that we've come up with, it was sort of like this almost overwhelming concept, right? The one that I think so many communities have talked about, and well beyond communities, global nations, which is how do we create a continuum of care, right? So that we are able to better navigate the continually complex world that our healthcare lives in. Very few of us anymore have one doctor. We all have many, many specialists. Way too often the imaging, the blood tests, whatever it is being used to diagnose, to monitor what's going on in our world from a health perspective resides in many, many, many locations. And even though hospitals are making huge, huge strides in bringing that information together, if you're working with different hospitals, let's say I want to consult with Mayo Clinic, even though my core hospital is here. Or maybe globally, I found out that there is a great new treatment that's being evaluated, but it's not even here in the US, or global countries that want to look to us. How do we start to share that information? So you can see how this quickly blew it up into something bigger. So we kind of had to bring it back to what about the person that's living in a home that has difficulty navigating the healthcare system. So Google with fiber could potentially be an infrastructure element to being able to deliver that. Think about the images and the diagnostics. Think about the way that many, many healthcare providers that might be serving me as one individual and looking at my healthcare, a cardiologist, a neurologist, my family health physician, my oncologist, depending on what's going on, right? How do they all share information? And when I show up in one of their offices, I'm not answering all the questions, right? Oh, have you had this test done yet? Or I didn't get that information. And the beauty of it is, sort of think about the Facebook idea, right? I get to control how my information is shared. I maybe have a swipe card that every time I go into a physician, every time I get a blood test taken, they know that I swipe that card, it goes into my centralized database. And it can be images, mammograms, whatever. That's all centralized in one place. And now when I go to a physician, it's all there and accessible. And the benefit is, now I really do have a team of physicians. We talk about physicians working in teams today, but we don't really get the benefit of it very often because it's hard for them to find the time to talk about one individual case when they have so many. So the big idea was, how do we develop this continuum of care for folks in Kansas City, and me as the individual, how do I benefit from it and feel good about the privacy of my information and that I get to control it. Maybe even I want to put some of my own information in. Maybe I swipe my card every time I weigh myself or take my blood pressure, and I'm actually even pulling in my own monitoring that I may be doing. So total care, continuum of care was the big idea. Well, that's great. But then we started picking it apart and we said, well, what are the elements of it specific to how we would make it happen? Well, maybe it's an opportunity for Kansas City to become more of that intellectual healthcare hub. Somebody's got to develop the data centers that are going to house that information and be able to deliver it. So why not let that be Kansas City where that data resides? And again, data could be data that comes from physicians, from labs, from me because I'm monitoring my weight or my blood pressure or whatever it is. But it's a great opportunity for Kansas City to start to step up and even further claim the medical technology sort of position that we've been working so hard to get into with the biosciences. How do we take it a step further with this? So that was sort of a play-off of the continuum of care. More specifically, we spent a lot of time talking about the senior community. I think everyone in the room of the group that we had probably had aging parents that they were trying to figure out, how do I do a better job of being a caretaker for my parents, especially if I live remotely? Well, imagine that they can be monitored, that I can have them go to their TV, and maybe now there's live video streaming through the TV, something easy that they can just touch and say, okay, I'm going to check in with Barb, my daughter, and let her know how my doctor appointment went. Or more than that, maybe I don't have to go to the doctor so often anymore. It's hard to get out, right? You've got mobility issues as you get older. It's difficult to get from 3 different doctor's appointments to all the errands that you have to run. What if now we can start to monitor, much as they were talking about with urban core, my blood pressure or the basic things that I should be able to do, maybe just virtually now instead of having to go into the doctor. Could that then reduce the strain on our healthcare system? Probably so. Would it give doctors more time and nurses more time to focus on more critical issues and not so much of the monitoring unless there's a problem? Maybe so. So those were all ideas on how to help utilize the Google Fiber technology for delivering information that ultimately would make lives easier. And then I'll just touch on one more. While we had many on our board up here, there was an interesting one that came out. And it kind of meant more for Google than maybe it means for us, but I thought it was really interesting. So one of the concepts was, well, maybe, especially for seniors who need help, right? One opportunity would be Google could position this as, hey, we can provide care, I'm kind of selecting my words carefully here, we can provide monitoring, right, inside your walls, and we can provide connectivity, that would be a better way to say it, inside your walls, right? You need a doctor to check you out, much like we were talking about in Urban Core, we can do that remotely now. But what if they also provided that connectivity on the streets? There's a big push right now towards zip cars. Well, what if they're Google branded, and now if I'm in my home and I need to get to a doctor's appointment, I use that mapping technology. No longer do I have to pay $50 for a taxi to get me to whatever doctor I need to go to. Now I can utilize a great big network where they know where the doctor's offices are in my network, how to get me there, maybe do it more as a community service, and even better, if I need somebody to come into my mom and dad's house, they don't need somebody there all the time, but I just want them to check in a couple of times a day because I'm out of town, use that same connectivity idea and that same transportation system to do the same thing, bring people in. So it could be fully integrated for inside the walls and outside the walls in terms of connectivity.